Bismillahirrahmanirrahim. Let's start my presentation with the quote of the day. Do what is right, not what is easy. Assalamu alaikum everyone. I'm Dr. Amna Khan. I'll be presenting a topic today, approaches to assess future needs of HRH, human resources for health, under the kind supervision of my most honorable supervisor, Dr. Saira Afzal. The learning outlines today would be assessing future human resources needs in healthcare, qualitative and quantitative approaches for HRH, public health performance management system, Wizen method, recent updates, MCQs. The learning outcomes at the end of this presentation, the participants will be able to describe the approaches to assess future needs of human resources for health. Why assessing the future needs? The healthcare landscape is evolving rapidly with shifting demographics, emerging technologies, and changing healthcare needs. Assessing future needs help us prepare for workforce shortages, reduce imbalances, and improve patient care outcomes. A well-prepared healthcare workforce is the backbone of any healthcare system. Types of approaches for assessment. The two types are quantitative and qualitative. Four main quantitative approaches. To estimate the HRH requirements, four methods have been traditionally described. Hall and Meja, 1978. The first one is need-based approach. Second one is demand-based. Third one is work-to-work population ratios. And the fourth is service target approach. The first one, need-based approach, forecast on basis of epidemiological and demographic trends. The second one, demand-based approach, forecast by changes in utilization of care. Third one is the work-to-population approach, which is according to norms. And the fourth is service target approach, setting targets of delivery, then converting those targets into health workforce requirement. Here you can see a table, and we are going to use this table to understand better all these four approaches. So the first one, need-based approach. So basically, it estimates future requirements based on estimated health deficits of the population, projects age and gender-specific service needs based on service norms and mobility trends. So here in this table, you can see the advantages and limitations of each strategy and approach as well. It has the potential of addressing the health needs of population using a mix of HRH, which is an advantage of it. So it is independent of the current health. It is logical. It is useful for some programs. It is useful for advocacy. And the limitations are it ignores the question of efficiency, requires extensive data. If technology changes, it requires norms update, is likely to project unattainable service and staff targets. So the next one is the utilization based or the demand based. It estimates future requirements based on current level of service utilization in relation to future projections of demographic profiles. So the advantage of this technique or the approach is economically feasible targets due to no or little change in population specific utilization rates, requires extensive data, overlooks the consequence of errors arising from the assumption proving to be valid, and produces a status quo projection since future population segments are assumed to have similar utilization rates as base year segments. The third approach is the health workforce to population ratio. A specified desired worker to population ratio. It's the advantage of this approach is it is quick, easy to apply, and easy to understand. The limitations are provides no insight to person utilization, does not allow to explore interactions. Base year maldistribution will likely continue in target year. Okay, the fourth one is the the next third one is the service target based. It targets for the production and delivery of specific outcome oriented health services. So the advantage of this one is the relatively easy and understandable, can assess interactions between variables. And the disadvantages are potentially unrealistic assumptions. Adjusted services target approach. So this approach, it identifies service needs based on epidemiological and demographic profile, identify tasks and skills required, estimates time requirements for each intervention, and translates time requirements. The advantages are useful for specific programs, looks all efficiency issues, useful to identify training needs, goes beyond the traditional occupation-based training practice towards competency-based training and service. And the limitations are requires detailed workflow studies or expert assessment and opinion, can only be effective if infrastructure, supplies, and logistics are in the place to support HRH. Here, this figure one, the adjusted service target approach can be better understood. You can see that by assessing the demographics, incidence, and prevalence of diseases and evidence-based health interactions. You get to know the service needs, and then there are service targets, and then you understand the training needs, then the skills required, time requirements, productivity, and the HRH requirements. And TTP needs, service targets, time, and productivity. Another approach called NTTP needs, service targets, time, and productivity was proposed to estimate the human resources requirements to deliver health interventions related to Millennium Developmental Goals. The quantity of services was estimated for 33 priority health interventions recommended by Health Commission on Macroeconomics and Health, which were advocated to address the disease burden attributable to TB, malaria, childhood disease, maternity-related conditions, and HIV/AIDS. Now, the approaches for qualitative estimation. How is performance in different circumstances? So that would be known by the performance appraisal. The main approaches are trait-based, MBO-based, based on behavioral competencies, 360-degree feedback. The trait-based. Personality traits assess knowledge, ability, judgment, reliability. So thus, it leads to the subject to the biases. Now, the other approach is the MBO-based, that is the management by objectives. Smart objectives set to improve and measure performances. So it is time-consuming, pressure on worker. Based on behavior competencies, strategic and analytic thinking, leadership, decision drive, interpersonal skills, flexible, confident, persuasion. It needs training for this method. 360-degree feedback. Basically, this is the combination of peer, superior, subordinate, and self-review appraisal, feedback from other people as well as employees, direct supervisor. If deficient performance found, how design appropriate solution? Training and assessment is done by the customer feedback, review recent publications, by employees questionnaire, interview, observe working practice, assess during workshops. Now, the traditional approach is historically HR needs assessment relied on analytical past data, like patient volumes and historic staffing levels. These approaches often fall short as they can't account for unforeseen changes or adapt to evolving healthcare needs. Emerging approaches. Modern approaches leverage cutting-edge technologies such as predictive analytics and modeling. They provide dynamic, forward-looking insights into HR requirements, improving planning accuracy. Technology can streamline healthcare delivery and alter HRH needs. Predictive analytics. Predictive analytics involves using data to forecast future HR needs. For example, it can predict nurse staffing requirements based on patient admission rates, improving resources allocation. Now, the rigorous methods for estimating HR needs. So certainly here are 3 points with the headings summarizing rigorous methods for estimating HR needs in primary health programs. The first one is the data-driven workload analysis. Second is the population-centric approach. Third is the engagement, stimulation, validation. Now we'll be understanding the Voisin method. It determines how many health workers of a particular type are required to cope with the workload of a given health facility. The Voisin method is a human resource management tool that assesses the workload pressure of the health worker in that facility. The Voisin method is simple to operate, use already collected available data. It's simple to use, applicable to staffing decisions at all health service levels, technically acceptable to health service managers, comprehensible, realistic, providing practical targets for budgeting and resource allocation. The objective of Voisin assessment. The primary objective of the Voisin assessment is to determine the staffing needs of healthcare facilities accurately. It helps healthcare managers and policymakers understand the gap between the current staffing levels and the required workforce to meet the healthcare demands of the population. The components of the Voisin calculation involves 2 main components: the workload standards and the actual workload. The workload standards are established for various healthcare tasks and service, specifying the expected time required to perform each. Actual workload is determined by collecting data on the tasks performed by the healthcare workers and the time taken to complete them. The Voisin method takes into account differences in service provided and in complexity of care in different facilities. The calculation of the staff requirements is based on the same medical standard in all similar facilities. No specific data collection exercise is required because the Voisin method uses available service statistics. 2 types of results, difference and ratios, are provided by the Voisin method. The ratio of the actual to the required number of staff is a measure of the workload pressure with which the staff is coping. The staff requirements of individual health facilities can be added together across administrative area to estimate staff requirements for districts, provinces, and nationally. The Voisin method can be applied for government, non-government organizations. and private healthcare facilities and for all personal categories, including non-medic ones. Managers at district, provincial, or national levels, as well as staff in charge of individual health facilities, can also use Wyzen to make better human resource decisions. Now, the limitations of the Wyzen method. Wyzen uses annual service statistics to assess workloads. The accuracy of the Wyzen method is thus determined by the accuracy of the statistics themselves. If a health facility keeps poor records, the Wyzen results will be inaccurate. The level of the detail in the service statistics affects the precision of the Wyzen results. For example, routine statistics report only a single figure for total visits to an antenatal clinic. Only the average time for such visits can be used in the Wyzen method. Now, the third one is the Wyzen method uses the previous year's service statistics. It thus calculates retrospectively what the staffing levels should have been last year. The fourth one is the shortages of medicines or supplies sometimes reduce the workload of a health facility. Now we will understand the steps involved. So see, the first one is determining the Wyzen priorities. Second is estimating available working time. Third is define components of the daily work. Fourth is set activity standards. Fifth is establish standard workloads. Sixth is calculate allowance factors. Seventh is determine required staff. See, here we again understand the steps. And the eighth, you need to know that after determining the staff requirements, we must know how to analyze and interpret the results. In this figure, you can understand the Wyzen methodology for calculating staffing needs. So basically, we have to understand that the two important components of the calculation must be there for any Wyzen ratio, the standard workload and actual workload or annual service statistics. So then we would be getting the Wyzen ratio. Using Wyzen results, two kinds of comparisons would be there. Difference between actual and required number of HRH shows level of shortage or surplus of HRH. The ratio of actual to the required number of human resource for health Wyzen ratio shows the amount of pressure which HRH category works under. Wyzen ratio is equal to 1 ratio HRH, then it's sufficient. Wyzen ratio less than 1, HRH not sufficient. Wyzen ratio greater than 1, more than enough staff. Requirements to implement. The steering committee of decision makers who review activity and launch standards and consider Wyzen results for management action. Task force of experienced, competent professionals from the category, facility, and level being addressed by Wyzen who implement and can train in the methodology. Here we can see some of the examples of the Wyzen method. Example from Indonesia, the Wyzen calculations for the TTS district. Here are some more examples of the Wyzen method. Public Health Performance Management System. Measures and monitor performance, promotes accountability, drives continuous improvement, supports evidence-based decision-making. Challenges and pitfalls. Challenges in HRH assessment include data, privacy, accuracy, concerns, and ethical considerations. Address the challenges through robust data, governance, transparency, and ethical guidelines. The recommendations. Recommendations for healthcare organizations and policymakers include adopting modern assessment methods, investing in data infrastructure, and fostering a culture of continuous monitoring adaptation. Address health equity. HRH assessments should consider disparities in healthcare access and outcomes among different population groups. The future needs. Here are 5 key points with the heading summarizing approaches to assess future needs of HRH, which are the human resources for health. The first one is the workforce planning models. Second is scenario planning. Third is data-driven analysis. Fourth, policy and reform considerations. And 5 is the stakeholder engagement and adaptability. The first one, workforce planning models, utilize mathematical models like Wyzen to estimate future HR needs based on population growth, healthcare utilization, and delivery changes. The scenario planning develop diverse future scenarios, consider factors such as policy changes, disease outbreaks, and population shift to assess their impact on HRH needs. Data-driven analysis rely on accurate data for assessing current healthcare workforce demographics, health needs, and utilization pattern, employing data analytics and predictive modeling. It ensures accurate estimation based on current healthcare workforce and utilization data. Policy and reform considerations evaluate the effect of healthcare policy changes and reforms on HRH requirements, as shift in regulations can significantly impact workforce needs. Changes in training programs can help scale up the healthcare workforce to meet future needs. Stakeholder engagement and adaptability. Engage key stakeholders, including healthcare professionals and community representatives, to ensure estimation align with local needs and expectations. The conclusion. To conclude, proactive workforce planning is crucial for the sustainability of our healthcare system. Embracing innovative approaches to assess future HR needs is the way forward. We encourage you to apply these insights to your healthcare organizations and communities. The role of WHO. WHO proposed coordinated health and human resource development as a more comprehensive and systematic approach for health systems and human resources development. The approaches propose fundamental changes in the philosophy of planning towards interdisciplinary and intersectoral planning. The Millennium Developmental Goals. In the context of the Millennium Developmental Goals, human resources for health pose a new challenge for health policy and decision makers in countries, and the question of the having the right numbers, the right skills, and the right distribution of health workers to meet the MDGs is one that many governments are struggling with. 3 of the 8 MDGs address health issues and aim at reducing child mortality, improving maternal health, and combating HIV or AIDS, malaria, and other diseases. The strategies and the constraints to implementation to achieve MDGs. So the major constraints are inadequate number of health staff due to low financial resources, uneven distribution of health workers at different levels, high attrition and low replacement rates, inappropriate or inadequate training, poor policies, high staff turnover, lack of supportive supervision, low moral and motivation, lack of integration with the private sector. An approach to estimating HRH requirements to achieve the MDGs, an intercluster collaborative working group within WHO is working towards developing a methodology to estimate the HRH requirements for priority health interventions. The approach involves the following steps. First, identify the needs for services. Second, identify the intervention required to deliver these services. Third, identify the tasks and skills required to deliver those specific interventions. Then fourth is estimating the time requirements for each of the intervention. Fifth is identify possible overlap. And sixth, estimate adjusted full-time equivalents. Now, time for recent updates. Measuring the availability of human resources for health and its relationship to universal health coverage for 204 countries and territories from 1990 to 2019, a systematic analysis for the global burden of disease study to 2019. The interpretation. Considerable expansion of the world's health workforce is needed to achieve a high level of universal healthcare effective coverage. The largest shortage are in the low-income settings, highlighting the need for increased financing and coordination to train, employ, and retain human resources in the health sector. Actually, the HRH shortage might be larger than estimated because minimum thresholds for each cadre of health workers are benchmarked on health system that most efficient translate human resources into universal healthcare attainment. The Policy Roundtable on Human Resources for Health. Globally, the vital role of HRH is in achieving SDGs and universal healthcare is critically acknowledged and duly emphasized. The international benchmarking for crucial HRH is 4.45 per thousand population, as per the WHO Global Strategy on HRH. However, for Pakistan, the figure stands for 1.45 critical health workforce for per 1,000 population. Punjab, with a population of 110 million, has 0.83 physicians and 0.56 nurses per thousand population, which translates into 94,179 doctors and 64,846 nurses. These are supported by 44,452 lady health workers and 1,799 lady health supervisors in the province. To address the critical shortage in HRH, PPHA organized a policy roundtable discussion. The objectives are understanding the importance of HRH towards achieving the targets set by SDGs and universal healthcare, current HRH challenges in Punjab, HRH reforms introduced in the last 3 years, way forward in the policy directions. An approach to estimating human resource requirements to achieve the Millennium Developmental Goals. In the context of MDGs, human resources represent the most crucial restraints in achieving the targets. Therefore, it is important for health planners and decision makers to identify what are the human resources required to meet those targets. Now, time for MCQs. The first MCQ, which approach involves the utilization of mathematical models such as the workload indicators of staffing needs, Wyson to estimate future HRH needs by considering factors like population growth, healthcare utilization rates, and changes in the healthcare delivery models. A, workload analysis. B, scenario planning. C, data-driven analysis, workforce planning models. And E is the data analysis. Anyone? The answer is D, workforce planning models. Number 2 is the researcher is working on HRH assessment tool. In the context of HRH assessment, what does scenario planning entail? A, analyzing historical workforce data. B, identifying current healthcare work shortages. developing different future scenarios to assess their impact on HRH. D, conducting community surveys to determine healthcare preferences, conducting seminars to determine healthcare preferences. Anyone? The answer is C. Number three is that in the context of MDGs, human resources for health pose a new challenge for health policy and decision makers in countries. Why is data-driven analysis crucial in assessing HRH needs? A, it helps policymakers make arbitrary decisions. B, it relies on predictions without the needs for data. C, it ensures accurate estimation based on current healthcare workforce and utilization data. D, it avoids the use of analytics and modeling, simplifying the process. Or E, it does not ensure accurate estimation based on current healthcare workforce and utilization data. Anyone? The answer is C. Number 4, to address the critical shortage in HRH, Punjab Public Health Agency (PPHA) organized a policy roundtable discussion. How can challenges in the healthcare policies and reforms affect HRH requirements? A, they have no impact. B, they can lead to shifts in healthcare delivery and workforce requirements. C, policy and reforms are entirely unrelated. D, HRH needs remain static regardless of policy changes. E, changes are not needed. Anyone? The answer is B. Question number 5 is, what is the primary benefit of involving key stakeholders, including healthcare professionals and community representatives in HRH assessments? A, it simplifies the assessment process. B, it ensures the HRH estimation. C, stakeholders have no role in HRH planning. D, it reduces the need for data collection. E, no significance. The answer is B. Number 6, healthcare organizations are keen to determine factors affecting HRH requirements in a developing country. How can the integration of technology such as telemedicine and digital health tools impact HRH requirements? A, technology has no relevance. B, technology can streamline healthcare delivery. C, technology is limited. Technology is primarily cost burden. E, it has no role. Anyone? The answer is B. Question number 7, an epidemiologist is studying about the disease outbreaks and global health trends. How do global health trends like pandemics influence HRH priorities and requirements? A, they have no impact. B, trends like pandemics emphasize the need for flexibility and adaptability in HRH planning. C, HRH priorities are solely determined by governments. D, global health trends have no bearing on HRH. E, has no influence. The answer is B. Question number 8 is, recommendation for healthcare organizations and policymakers are being considered for improving healthcare standards in HRH assessments. What is the significance of addressing health equity? A, health equity is unrelated to HRH needs. B, HRH assessments should consider disparities in healthcare access and outcomes among different population groups. C, is health equity is only the concern of social worker. D, addressing health equity complicates HRH estimation. E, health equity is only the concern of a doctor. Anyone? The answer is B. On ninth number, the policymakers in a country are opting approaches for policy and reform consideration. How can adjustments in education and training program impact HRH planning? A, education and training programs have no impact. B, changes in training programs can help scale up the healthcare workforce. C, HRH planning is entirely separate. D, training programs only affect the healthcare professionals. E, they are of no use. Anyone? The answer is B. Number 10th, a student of MP is studying approaches for qualitative estimation of HRH. The combination of peer, superior, subordinate, and self-review appraisal is known as a 360-degree appraisal, human resource accounting system, all-round review, feed-forward, or trade-based. Anyone? The answer is A. Here is the key and the references. Kindly subscribe and like the channel. Thank you so much, everyone, for your time.